Alberta privatized their version of the LCBO in 1993. Did it work? Let's take a look. First things first, if you're talking about access, yes, it 100% worked. Because now 64% of Albertans live within 1 kilometer of a liquor store, with that number being 41% in BC and 30% elsewhere in the country. What about jobs? When they opened up all these new stores, it created a ton of new jobs, but these jobs had lower wages than before privatization. So yes, it created more jobs, but it made them lower paying. What about consumer prices? Did they get lower? Prices actually marginally increased after privatization. And if you were to compare a product like Crown Royal at the LCBO, it's $33.95, while in New Brunswick it's $31.29, whereas in Alberta it was actually more at $33.99 at Real Superstore. So yes, when things are on sale, the sales would be larger, so when it is on sale, it would be cheaper. Otherwise, prices are the same, if not slightly more expensive in Alberta after privatization. What about government revenues? They actually went down. The government's approach has led to a loss over time in government revenues by not maintaining the 1993 levels of tax revenue per liter of alcohol sold. They estimated that nearly $1.5 billion in their 2012 report has been lost, with the Fraser Institute claiming that lower revenue is because of the markup, not because of privatization itself. So when Doug Ford makes the argument that revenues will go up under privatization, that's not really true because prices will go up, which means that people will actually buy less product. And lastly, what about alcohol harm costs? That's called your alcohol deficit. In 2020, Alberta had $1.3 billion in alcohol revenues and $3.1 billion in alcohol harm costs, which was a $1.8 billion or 95 cents per standard drink sold in alcohol harm. Ontario had a total deficit of $1.9 billion, which was 0.34 cents per standard drink sold. That's because we have a larger population, which means we sell more things, which is why the deficit can be the same number, but still be less per sold. Albertans also drink more on average than people in Ontario. So overall, it would in theory cost more in terms of healthcare and harms to society. I don't actually think I've ever come across something in Canada over the last 30 or 40 years where privatization has actually caused more benefits than harms to society. Whether we're talking about the privatization of energy, alcohol, medicine, Air Canada, Petro-Canada, all that kind of stuff. When we privatize things, it increases costs for consumers and creates less revenue for the government. Long story short, if Doug Ford is saying it's a good business idea, it's probably not, especially considering he ran his family's business into the ground. Hey, that's his family's words, not mine.